patient. So it's a pleasure to see you.
It's my pleasure, Dr.
Yeah, I'm really surprised.
Yeah.
I mean, we're talking, what was the date of the transplant? The last one?
The last one was 27th of February 2003.
20 years. More.
More than 20 years.
More than 20 years.
Yeah.
Over 20 years ago, Esha was suffering from a highly aggressive blood cancer that was resistant to standard treatments. She underwent 2 bone marrow transplants, but unfortunately, her disease relapsed. To save her life, Professor Slavin decided to perform another transplant, followed by therapy with intentionally mismatched donor lymphocytes. He named this the iMac method.
And here you are.
Yeah.
Beautiful, without any problems.
Thank you. Yeah.
Perfect skin, because many patients after transplant have terrible skin with graft versus host disease.
Yeah, I know.
GVHD. And you? Nothing.
Yeah.
And what we see example is a perfect solution. And I would like to share with you why this is so exciting. Not only because you were cured, but also because this brings a new concept how to cure patients, not only with leukemia, lymphoma, myeloma, and also, I think, solid tumors like breast cancer, lung cancer, in the future, is because of the concept that cured you. So let me explain to you what that is.
Thanks. Please.
Traditional cancer therapies, such as chemotherapy, can be effective in reducing the size and destroying the tumor. However, after several cycles of treatment, malignant cells often develop drug resistance, and the disease progresses or relapses. Additionally, chemotherapy is unable to eradicate cancer stem cells, the cells that initiate malignant tumors, which may be the cause of recurrence.
In general, when chemotherapy fails to cure the patient die. And the reason is that when chemotherapy begins, some cancer cells respond, but the ones that remain are resistant. The ones that remain, they don't die,
They get stronger.
they get stronger. So as the treatment progresses, the treatment selects the more resistant cells. So now it's more time and with more chemotherapy, it becomes more and more difficult, finally completely impossible to cure. And especially if you take cell which is maybe 1 in a million, which is called cancer stem cell. Cancer stem cell is the cancer initiating cell.
Mm-hmm.
Every cancer begins with one cell.
One cell, yeah.
And therefore, you don't kill them all, it's always a chance it can kill. You don't take the kill. So the question is, what do you do? If the cells are completely resistant to chemotherapy, to radiation, to everything. The next solution, which is now very popular, millions and billions of dollars of drugs, is called immunotherapy. Because the immune system can kill cancer cells, even if cancer cells are resistant to chemotherapy. So now there's a whole world of new immunotherapy procedures coming up to the market, and they are very interesting and very effective, but not very curative. They can, slow the disease progression, sometimes reduce remissions, but usually not complete cure. So what makes it different? What makes the difference is the mismatch. Why? Because this is something that even the doctors don't ask for. What I'm telling them, believe it or not. As Einstein said, that discovery is to see something that everybody has seen, and to think about something that nobody thought. So, when you activate the immune system, it can react against cancer, but not completely. Why not? Because the body has a mechanism to accept anything that grows into the body. If I will put my kidney to you, you will get it, there will not be one cell. If I give you kidney and liver, 2 organs, one is another cancer, and I don't give you any drug, you will kill 5 kilos, not even one cell alone. So, why the woman does not reject the baby? The baby is mismatched. Should be rejected.
Yeah.
Why not? Because the baby has 50% information from mother, 50% information from father, so it's mismatched. Should be rejected. After the baby is born, if you take a piece of skin, you put on mother, immediately reject. Why we don't reject the baby? Because the baby started from relative first, inside the mother, so whenever the release system is something from the beginning, it is regarded as cell. Because the tumor started to grow in your body, and therefore the body thinks it is like normal blood cells. So the cell can reject too long disease. And even if you activate the immune system with immunotherapy, you can do some very specific things, but not complete things. If you use mismatched lymphocytes, mismatch always kills everything. Always, without exception.
The iMac method is based on the concept that a patient's own immune system is unable to destroy all cancer cells. Conversely, pre-activated donor lymphocytes, a type of immune cell, can eradicate every single cancer cell through a mechanism similar to organ rejection. Esha was one of the first patients to be cured using the iMac method. More than 20 years after the therapy, she is completely healthy and living a full life.